In-depth coverage of the top stories and breaking news when it happens. News Radio 1080 KRLD.
More people are planning to come out of their lockdown cocoons. They're finding they may want to make some changes to their appearance after spending so much time alone. They're going to be seeing more people, and they might not have the protection of the masks to hide their smiles. That's the main reason dentists are seeing a lot more patients coming into their offices to get some work done. On today's Ask the Expert, we're joined by Dr. Sonia Reddy from Professional Dental. She's in the KRLD Zoom room. So why are people doing this?
We call it mask mouth in our offices. It's actually described by a number of side effects from wearing the mask from an extended period of time. So not only cosmetic, but I think people are complaining of bad breath. And that's caused because of the dehydration, because when you wear a mask and you drink less and less water and you breathe through your mouth, it's causing dehydration, which is also leading to more tooth decay and bad breath. So, people are overall, I think, concerned now that the masks are off and people get to show off their pearly whites. So they're more worried about how they're looking, and they're more yellowier than what it was before, because I think nobody really cared about how the teeth were.
And what about just doing those procedures after, we get some stimulus check money, the economy's starting to come around? Are you seeing people just respond to this freedom that we're finding again?
Absolutely. I see, as we know, a lot of dental insurances are only covering majority of the health conditions and oral diseases. So they don't cover cosmetic procedures like whitening of the teeth and veneers. And a lot of patients need those treatments to be done. They want the teeth to be straightened, number one. And then when the teeth are straight, they want more and more cosmetic procedures. They want to straighten the teeth either using veneers, or they're using Invisalign or any clear aligner therapy that's out there. And they're using their stimulus checks. People are coming out and they're becoming more social. So they want to come out, and they've stayed at home looking at themselves for so long.
One thing that COVID has done to us for a lot of people is they've had to deal with more stress, and that can cause problems with your teeth as well. What kind of things does stress cause?
Yes, I think stress has caused them to grind more and clench more. And I have seen that they're grinding their teeth and they're cracking their teeth. We also called it COVID clench because of the stressful COVID year last year. We saw a lot of breakage in the teeth. So we've been fixing, probably last year was like a whole of last year was a lot more than last 5 years of my career. We're fixing the teeth. So there's a lot of sleep apnea cases being diagnosed, because a lot of people may or may not know sleep apnea is also related to teeth grinding. So when we sleep, the tongue falls back and people can't breathe, so they grind their teeth. And these are all related to COVID-19 symptoms as well.
Has there been a big pile up of just people needing to get in and see you, and other dentists or dentist appointments tough to come by right now?
Yes, we are booked solid almost 6 months ahead now, because I think people are more comfortable coming to dentists as well. They know that we're taking all the precautions to prevent any of these infectious, contagious diseases. And people are more confident now that we're all vaccinated in our office, and almost everybody is getting vaccinated. So yeah, definitely a huge influx of patients.